over the last sort of 10 to 15 years, I've been involved in a number of different approaches to reducing the burden of tobacco, alcohol, poor diets, particularly in Australia, but also globally. And what we see is the fact that the big alcohol, big food, sugary sweetened beverages companies using virtually the same tactics as tobacco in terms of undermining effective public health approaches. And what's been interesting is that, tobacco, because of the Framework Convention, they aren't allowed it around the policy table. Alcohol and junk food have managed to make sure they are actually around the policy table, either internationally or in most countries. And they're doing everything they can to undermine successful public health. So what do? They attack the science. So they then try and discredit not only the science but the scientists, and they overtly attack effective and track them. We know we've been tracked by the tobacco industry. It's in their reports. We know that many academics are being tracked by firms like Coca-Cola. We know that tobacco control advocates are actually having their lives threatened in many parts of the world. It's very dangerous to be an anti-tobacco advocate in Nigeria or in Indonesia, or for that fact in Malawi. So the companies are the big, what I would now call supranational corporations. And they're supranational. They're above the state. I mean, of the world's 100 largest economies now, 61 are corporations. So where is the power now? It's less and less with states, and more with corporations. Some corporations are very good, I reckon, but some of the particularly unhealthy commodity ones are pretty dangerous. And they're doing everything they can to make sure there's no regulation, and the enemies of regulation have become the enemies of science. The first thing is actually know what they're doing. That's the first thing. I just don't think that we track what they are doing and find out and actually try and mitigate against that. So, I mean, one of the things we should be doing in the next 20 years, whether or not we do it, is really track the operations of these companies. In other words, what's happening to pricing levels, to production levels, to advertising, how much are they donating in political donations, how many lobbyists they have. We should be following them, just as we do in communicable diseases like malaria. We track the vector, right? We actually look at how many mosquitoes are around and we watch them. Well, these companies are the vectors of the 21st century pandemics. We need to be tracking them just as we do for communicable diseases. Well, I mean, for any effective public health approaches here, you've got to have effective regulation. So, for example, around advertising, whether it's alcohol or whether it's junk food, obviously tobacco. You look at the Framework Convention on Tobacco Control, then that's what works. And our children globally or in any country shouldn't be bombarded by really inappropriate but yet powerful advertising to really get them hooked very early. In Australia, for example, we have this rather unfortunate connection, the fact that the kings of Australian sport are the kings of booze and junk food and junk drinks. There's a very high association. That's not very good. I mean, we need to have things like the sugar tax, for example, where we're actually just starting to change consumption patterns to make them much healthier. It's not banning the drinks at all, but it's changing so that we can push people towards healthier consumption, whether it's food or drink. I mean, tobacco taxes, that should be something that every country actually applies, yet the tobacco companies are very strong, particularly in places like Africa, where they can prevent that happening. Yeah. I mean, this is where I learned so much, I guess, is that as chairing this National Preventative Health Task Force, and our job was to, advise on how we should reduce the burdens of obesity and alcohol and tobacco. And in that time, tobacco was sufficiently on the nose, as they say, that they weren't around the policy table. But big alcohol and big food were. And I must admit, this is 10 years ago, I thought, well, maybe it's good to have them in the room. That's their mantra, we're part of the solution. And so I thought that watching over the last 10 years and watching them, not only in Australia, but globally, undermine every effective possible intervention part of the public health that we could do to improve the public's health, they've done it all. I mean, they'll create code of conducts that are completely ineffective to say, well, look, this is what we're doing. Or, as they've just said recently, it's well, we'll reduce the amount of sugar by 20% by 2025. That's happening anyway because of the work that's being successfully done about changing communities' opinions. They won't have to do anything. We know that's happening, yet they're sort of claiming it as a positive. So, we need to know much more about what they do, how they advertise, how they promote their products, so that we can actually learn from them and start to promote much healthier products. Sure. I mean, one of the obviously big issues that we're concerned about globally is, well, are the policies and programs and interventions we've run in high-income countries, are they actually relevant and can they be effective in low and middle-income countries? And I guess my first sort of understanding of this is that the companies that are promoting unhealthy products have actually transferred their approaches incredibly effectively. So whether that's in Malawi where I've been working, or whether it's in Brazil, or whether it's in Nigeria, then the unhealthy commodity companies are working incredibly effectively. There's very few places you cannot go and buy a Pepsi or a Coke or find a Benson and Hedges or whatever because of the distribution. And they do two things. They make sure it's available in your mind. In other words, it's front of mind, and they make sure it's physically available as well. And again, we can learn a lot from the way they're promoting their products. In terms of the actual policies, yes, I think a lot of them are transferable, but it just means that you've got to really have a strong, committed coalition that's working on this. So whether that's civil society groups like cancer control societies in every country, whether it's getting and helping them work with local academics. They've got to band together, working with doctors groups and nurses groups to actually create the level of sort of community interest and involvement, and sometimes outrage, that actually the politicians start to listen to and say, yes, we actually do need to implement what's been done successfully in other countries and do it in our country as well. But that's not only in lower and middle income countries like in Australia. We've been very successful with tobacco control, but around improving diets, it's not working effectively at all. The companies the supranational food and beverage companies are really just too strong at the moment. Because of the time. I mean, since the early 1950s, when we knew the link between tobacco and cancer, it took then 20 years to really start to get effective programs up and running. And it takes many years. 3 rules in public health: persistence, persistence, and persistence. And just keep at it for a long time. We're much earlier on in those other 2 areas, but and that they are different products, so it's harder. The companies have learnt from any of the mistakes that tobacco companies made, and also we need to remember that tobacco companies are making a major resurgence. Now that they're buying up all the e-cigarettes, they're now, they've now produced heat-treated tobacco, not only burnt tobacco. So their basic approach to life, or to their bottom line is, all we need to do is keep something in people's mouths, and we will make a big profit. And the earlier we can get them, we can get young kids on e-cigarettes, that'll help them either smoke our heat treater cigarettes or the standard cigarettes. Well, I mean, I think that maybe the key piece of advice for the transferability in low and middle income countries is, yes, these approaches do work. It's a question of actually building a very strong, determined coalition of groups that are going to push it through in your country until you get that really strong local cancer society really getting moving with academics, with the medical professional groups, and with others, and really getting interested decision makers on side. That's where you've got to start. Look at the sugar tax in Mexico. I mean, these things work in countries that really want to take it up as an issue, but they don't just happen out of thin air. It's a lot of very determined, very well planned advocacy. It's learning from, in a sense, sometimes how the corporations work and literally stealing their ideas.